Today's our topic is self-breast examination. In the recent days we are seeing the most of the cases related to cancer, especially breast cancer. To prevent and protect from breast cancer we need to do self-breast examination. Let's get into the topic without any delay. Introduction of self-breast examination, SBE. Performing a self-breast exam, SBE, is an important way to detect any unusual changes in your breasts, which can be an early sign of breast cancer. Here is a step-by-step guide to doing a self-breast exam yourself. Step 1. Choose a time in your menstrual cycle when your breasts are least likely to be tender or swollen. For most women, this is usually a few days after their period ends. Stand in front of a mirror with your arms at your sides. Look for any changes in the shape or size of your breasts, such as dimpling, puckering, or redness. Check for any discharge from the nipples. Raise your arms over your head and look for the same changes in your breasts as in Step 2. Place your hands on your hips and press firmly to flex your chest muscles. Look for any changes in the contour of your breasts. Step 3. Lie down on your back and place a pillow under your right shoulder. Use your left hand to feel your right breast in a circular motion, starting from the outer edge and moving toward the center. Use light pressure for the first pass and medium pressure for the second pass. Finally, use firm pressure for the third pass. Step 4. Use your fingers to feel for any lumps or hard, dense areas in your breast tissue. Pay particular attention to the area around your nipple and the armpit. Steps 5 and 6. Repeat step 4 on your another breast. It's important to remember that finding a lump or other change in your breast does not necessarily mean that you have breast cancer. However, if you do notice any changes in your breasts, it's important to see a doctor as soon as possible for further evaluation. Why self-breast examination, SBE, need? Performing self-breast exams, SBEs, is important because it can help you become more familiar with the normal appearance and feel of your breasts. This familiarity can help you detect any unusual changes in your breast tissue, which may be a sign of breast cancer or other breast conditions. Breast cancer is one of the most common types of cancer that affects women. Early detection of breast cancer is key to successful treatment, and performing regular self-breast exams can help you identify any changes in your breast tissue early on. If you do find a lump or other change in your breast, it's important to see a doctor as soon as possible for further evaluation. While SBEs are not a substitute for regular breast cancer screening, such as mammograms or clinical breast exams, they are an important tool in detecting breast cancer and other breast conditions. It's recommended that women should begin performing self-breast examination, SBEs, in their 20s, and continue to do so every month throughout their lifetime. Now we know uses of it. The primary use of performing a self-breast exam, SBE, is to detect any unusual changes in your breast tissue, which can be a sign of breast cancer or other breast conditions. By performing a monthly SBE, you become more familiar with the normal appearance and feel of your breasts, making it easier to detect any changes early on. Early detection of breast cancer is crucial for successful treatment and a positive prognosis. The earlier breast cancer is detected, the greater the chances of successful treatment and recovery. In addition to helping detect breast cancer, SBEs can also help identify other breast conditions, such as cysts or fibroadenomas, which may require further evaluation by a doctor. Regular breast cancer screening, such as mammograms and clinical breast exams, are also important tools in detecting breast cancer. SBEs should not replace these screening methods, but rather be used as an additional tool in breast cancer detection and prevention. Overall conclusion SBE. In conclusion, self-breast exams, SBEs, are an important tool in detecting any unusual changes in your breast tissue, which can be a sign of breast cancer or other breast conditions. By performing a monthly SBE, you become more familiar with the normal appearance and feel of your breasts, making it easier to detect any changes early on. While SBEs are not a substitute for regular breast cancer screening, such as mammograms and clinical breast exams, they can be used in addition to these screening methods to improve the chances of detecting breast cancer early. Early detection of breast cancer is crucial for successful treatment and a positive prognosis. It is recommended that women should begin performing SBEs in their 20s, and continue to do so every month throughout their lifetime. If you notice any changes in your breast tissue, such as a lump or unusual discharge, it's important to see a doctor as soon as possible for further evaluation. Even though we are seeing the breast cancer in the earlier stages, you need to prevent ourselves to protect from the dangerous disease with SBE.